Welcome to Uncaged. Today we're speaking with Carey Goryl. Now, we will be talking a lot about helping the recruiters of doctors, physicians, providers. Carey has built an organization that is the Association for Advancing Physician and Provider Recruitment, AAppr. They're really aiming to redefine recruitment and retention and looking to be the professional organization where physicians and provider recruitment leaders and others who influence recruitment, onboarding, and retention can connect, learn, and advance their careers. The association offers its members and the industry thought leadership on all topics related to healthcare recruitment. And today they boast close to over 2,000 members and growing. So I'm excited to learn more about AAppr. I hope I got the acronym right, Carey. But before we get there, tell us a little bit about you and your career.
Oh, I'd be happy to. Well, whenever I think about who I am, I often start with my parents, right? So a little bit of background. My parents are both engineers. One's electrical. And when I told them in my early college days that I was going to change my career from law enforcement to social work, they were very confused. This didn't make any sense to them. I think my father was worried like how I was going to make a living and, I'm sure back then didn't want me living with him for the next 40 years. But no, all worked out. I married an entrepreneurial salesman at the time, who eventually quickly became a teacher, a football coach. I have 2 kids. One of them has a love for space, and the other one just likes to solve puzzles. And, I think while my parents' concern, it really was a shock to me at the time. I wanted to change the world. And I thought at first I was going to do that through law enforcement. Social work was a way for me to help others. And social work in the way that looked at systems change. How do we look at organizations, look at communities, and actually solve problems as opposed to putting Band-Aids on solutions? So, when it comes to me, I've always been a person that gets thrust into the leadership role. People often look to me for direction, for answers. I've learned over the years they look to me for inspiration, although sometimes that's a shock to me too. So over and over again, I find myself in these roles, whether it was in high school, college, my careers. I became a CEO for an association when I was 29 years old. I've been doing it now. If you want to do my math, I've been doing it now for 18 years at 2 different associations, and I love it. It suits me well.
And I mean, trade associations are not easy enterprises to look after. And certainly you've been able to build and grow the Association for Advancing Physician and Provider Recruitment. But tell me a little bit more about the pathway at AAppr and what you and the team are focused on right now.
What we're focused on. Well, at any association, just to clarify, we're actually an individual membership association. Our members are individuals who work at hospitals, health systems, clinics all over the United States. And these clinics and hospitals have decided that having an internal recruitment team is the best way to recruit physicians and over the last 5 years, advanced practice providers. It's a different type of recruitment. It's different than IT, it's different than finance, and it's different than just the thousands of employees that healthcare organizations need to hire on an annual basis. Physicians are the lifeblood of organizations. They generate the revenue for the organization. And so to move physicians, we move them around the country. We help them with where they want to go. We hopefully persuade and entice them into into communities that really need it. And our members facilitate that. So we have a board of directors. They put together a strategic plan that then my job is to bring that to fruition. One of the most exciting things I'm working on just as an association is a merger that we have been working on. We have 7 small groups, right? We are the national organization. We have a variety of smaller groups at the local level. And from a membership association perspective, it's all about the professional development that we're doing for our members, but then also the engagement in the community between and among members. Sometimes it's a lonely world. And I don't know if you're in any profession where you feel like there aren't that many people who do the same sort of work. A professional association is the place you go to sort of find your work people.
Yeah. And I think about, Carey, that you have been the CEO of this association in probably one of the most challenging or interesting times in, I'd say, the medical profession. I mean, certainly we've lived through COVID, and on the show, I've spoken to groups that work with nurses and groups that work with doctors around the world. And one of the themes has constantly been the real shortage that we have in even the best health systems to find talented practitioners to join. Tell me a little bit about kind of how that whole space has evolved over the last couple of years, and where you guys have played in that world.
The physician shortage is not new to us. It existed before COVID. We have been watching this trend for many years, and it is, as the years go on, getting worse. COVID certainly was the accelerator of that shortage because of just then the increased retirements, the increase in just being exhausted with the work. And again, people, if they're not retired, some physicians still left their profession, only creating matters worse. So the shortage is real, but it's more nuanced than that, because sometimes it's just a maldistribution. Urban areas, fun places that are fun to live, generally don't have the challenges that say rural, remote, underserved communities have. So trying to encourage physicians to go to those places that patients can be seen is another difference. And then, just finally, when you look at the shortage, then you have to look at like your pipeline that goes into creating this profession. And when you consider just the amount of debt that it takes, the access to get into the system, the needs to think about how long it takes to become a physician, and even just some of the barriers that exist for some people, so than others, to go through quite an extensive process to become a physician, we make it very difficult. And someone that's to weed things out, and we should, but I don't know that is actually serving us well at the moment.
Yeah, I mean, I think about the rural practitioners a lot with my own parents. They're in their 80s and they live in very, very rural Vermont. And that is always a question when anything goes wrong. How good or what kind of care can they actually get? So that's an interesting time. Well, you talk to the members of the AAppr. Right now, where we are in the world, what are some of the hot topics that they are coming to you and saying, hey, Carey, can we talk more about this or that?
Well, we're all trying to figure out where is the next shortage area. In some specialties, there isn't a shortage. But in some areas there are, like urology, gastroenterology. There are many other specialties. And so we as association, we track how long it takes to sort of find and fill these positions. But again, it's always more nuanced than that. How long does it take to actually bring a physician on board through credentialing and licensing, payer enrollment? On average, it probably takes, again, this is a really rough average, about 4 to 6 months to find a physician in a uncomplicated specialty. Uncomplicated meaning there aren't like 5 of them that we're all fighting for. 4 to 6 months to find them and come to an agreement. In a lot of states, it takes probably another 4 months. And then depending on the state, depending on the organization, maybe even as as high as 9 months to go through the process of enrollment, credentialing, privileging, that by the time you have an opening, you probably aren't going to have a replacement physician seeing patients for another year. And a year is an average good case scenario. In a rural area like Vermont, like you mentioned, maybe it's 2 years. And so here's what happens. What the general public is going to even more so start to experience is that your provider is going to change regularly. We have like a stopgap solution called locum tenens physicians. Locum tenens are, temporary. They come into a community, maybe they work a week, 2 weeks, 6 months, but they're not there permanently. And so that's how organizations fill that stopgap. And so as patients, we're going to see different providers. We're also probably going to have to drive farther. Physicians will be concentrated in larger urban areas, and those who live far away, which creates its own complexity, might have to drive farther to see the physicians that they need to see.
I had no idea that a recruitment process could take a year, maybe even 2 years. That's incredible. And that really does present a huge challenge. Is there any movement to expedite that, or is that the way it is, basically?
In part, it is the way it is. Over the last couple of years, especially the last 5, we have seen just a greater acceptance and embracement of using and leaning on advanced practice providers, the nurse practitioners, physician assistants. They are really becoming the new front line for much of primary care. Allowing physicians to then specialize and work on the more complex cases. That's one of the stopgaps. In Congress, there are a couple of bills that look at expanding the number of residency slots, right? So you go to school, medical education, then you need to become a resident. Right. The number of residency slots is restricted or capped by the federal government. It's a funding issue. And in the late, it was maybe late 70s, early 80s, there was a thought that if we capped the number of people who could become a physician, we could control healthcare costs. Less physicians means less procedures and costs. I don't know that that makes sense now, and there's always a logic, no matter where people are coming from. So we're slowly trying to increase the number of people who are able to go into residency slots, but it's 200 people more this year. It's a trickle.
Are you finding that people recruit overseas physicians?
Well, that's a whole nother conversation, right? We call them international medical graduates. We create a lot of extra hurdles. Some do to make sure that there's safety and that those physicians are properly trained and educated. But it then flows into the immigration challenges that we have and visas and how long can you come before you have to go back home. And again, if we're thinking about continuity of care, but you can only get a 2-year visa and then you have to go back home, it's
problematic. Yeah. You mentioned that you've always been placed in leadership roles here, and certainly I see that you have extensive experience leading associations in the medical field. You were the chief executive officer at the International Association of Forensic Nurses as well, before moving over to AAppr. But tell me a little bit about what drives you, Carey. You clearly have a passion for this space. Where do you think that comes from?
I'm a change agent. I just go back to like my social work era. I want to find solutions. I'm driven by that, and leadership is a passion of mine. I've always wanted to be the boss that I always wanted. And I take great effort to walk the walk when it comes to leadership. And so, For me and my team, I love not only developing the members of my organization and giving them tools, but I also just love having a staff and a team that works together, that I can coach, that I can help them make their own lives better. I see a lot of great power in just helping one person at a time.
Yeah. Well, you're clearly doing a great job. I mean, the organization is growing, but clearly the demands in the medical field are not slowing down. It seems to me that there are more advanced physicians needed every day. When you look out at the horizon, I'd say the near future, let's say the next couple of years, what's on the docket for the association as well as broadly in the field?
In the near future, broadly speaking, we have to get involved in advocacy efforts. There's only so much that an individual can do, let alone an association. But again, the power of associations is leveraging the power of a group. And we'll be getting involved in legislation or influencing regulations, putting our voice in the room for how perhaps it's about representing how physicians experience the process of being employed and hired and moved around. That is completely absent from most conversations. And just the downstream impact of being careless with our strategy for supporting the development of the physician and APP profession, making sure that they have the resources they need to be strong, to stay in the profession. It's in everyone's best interest that we figure that out.
Yeah, and I certainly can see where essentially public policy, sometimes private healthcare, public healthcare have to somehow find a way to find common ground on these issues that we can move forward faster to help people come up with solutions and hopefully get my parents some good doctors in rural Vermont.
It takes partnership. It takes partnership of entities that maybe are more competitors on the day-to-day realm. We've got to bring organizations together.
Absolutely. Well, Carey, thank you so much for being on Uncaged. If someone wanted to learn more about the Association for Advancing Physician and Provider Recruitment, I'm definitely going to challenge you to say that 10 times fast at some point here. Where should they go to find that information?
Super easy. It's www.aappr.org. AAppr.org, 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 AAppr.org. I think 5 times is good enough.
Excellent. I got it. Well done. Well done. Well, Carey, again, thank you so much for being on the Uncaged show. We've been speaking with Carey Goryl. She is the Chief Executive Officer for the Association for Advancing Physician and Provider Recruitment. And we've been talking to her really about the state of the physician recruitment marketplace and what the AAPPR is offering and some of the challenges that they're facing. And it really seems like there's a real need for what the association is doing and bringing together not only the basic needs of its members, but also helping to influence public policy as we try to build a more efficient and sustainable healthcare system. So, Carey, thank you again for being on the Uncaged show, and we look forward to having you back.
Thank you so much for having me.